Q-tips can actually do it. That is right. Even though you might be using these to clean out your ears, Q-tips can actually predispose you to having an ear blockage. I know you're saying, well, how could this happen? Well, it happens because oftentimes when people put that Q-tip in their ear to clean it out, they're actually pushing wax further down. I've seen this lots of times in the office. It's one of the reasons why we do not recommend Q-tips to clean out your ears. We say nothing smaller than the elbow should go in the ear. One of the other reasons why we say don't use Q-tips is that they can actually be damaging to the ear canal, the eardrum, etc. But yes, Q-tips can put you at risk for an earwax blockage. Avoid these. Guys, we are talking about earwax blockages. Okay, but first of all, let me let you know, earwax by itself, not a bad thing. Earwax is actually good. It's healthy. It's protective. We like earwax, even though it can sometimes seem a little gross, okay? And actually, our body has its own mechanism for getting rid of wax, for sort of gradually getting it to come out of the ears. But sometimes, in some situations, create environments where that earwax does not come out the way it should, and that can create a situation where we get an earwax blockage, or what we call medically a cerumen impaction. What's the problem with that, you say? Well, you can get ear pain, a sense of ear fullness, ringing in the ears. You can feel dizzy. You can feel off balance. It can be uncomfortable. It can be itchy. All sorts of things. And that, guys, is a problem. So that's the context in which we're talking about an earwax blockage, is when it's blocked to the point where it's causing you symptoms. That's a problem. And as we mentioned before, Q-tips can predispose you to that. Other things that can put you at risk for a blockage, an earwax blockage, are these. Not specifically Apple stuff, but we're talking about earbuds that you put in your ears to listen to music, talk on the phone, or whatever. Also things like hearing aids or anything that you're sticking into your ears regularly. And why, you might wonder. It's kind of interesting. Actually, sticking things in our ears can actually send signals to our ears and our brain that more earwax should be produced. That's right. So sometimes what happens when we wear hearing aids or other things, we use them, it can actually stimulate more earwax production, etc., and predispose us to an earwax blockage, among other reasons, okay? Keep that in mind. Other things that can predispose you to having an earwax blockage. Hairy ears. Yeah, hairy ears can do it. If you have hairy ears and you suffer from earwax blockages, well, maybe think about that. Talk about it with your doctor. Also, another thing is certain skin conditions, right? So we can get skin conditions really on any skin on our body. And sometimes when people have eczema or something called seborrheic dermatitis on the inside of their canals, they may slough off skin on the inside of the canals as well. That flaky skin can mix with the earwax and create an environment that's more conducive to an earwax blockage happening. So sometimes those skin conditions can do it and predispose us. Sometimes people have just narrow ear canals. I mean, literally, sometimes I'm putting them looking in people's ears, right, using the otoscope, and sometimes I'm like, oh my gosh, you have little baby ear canals. Not literally little baby ear canals, but their ear canals are super small. And if you can imagine, if an ear canal is super small, it may be harder for that wax to gradually come out like it should. Also, some people have had ear surgery or multiple ear infections or trauma to their ear, and that can create an environment where earwax just doesn't come out a lot and can cause an earwax blockage, predisposing people to the symptoms that I mentioned before. Oh my gosh, this one, age. Just age, yeah, actually can predispose us to an earwax blockage. You know how? I think this is super interesting. As we get older, our earwax tends to get harder and it also gets thicker. Both of those qualities are not the most conducive to earwax coming out on their own, coming out on its own, right? So the harder and thicker the earwax, it just may not come out so easily, and we might be more susceptible to having an earwax blockage, okay? We talked about the Q-tips. Oh, did I mention that some people just make too much earwax? Did I mention that? I don't even remember. But some people just make tons of wax, okay? Some people just make lots and lots and lots and lots of wax. Like some people I see every, 4 to 6 months for ear cleaning because they just need it. And some people just don't make so much wax. So, those are some of the reasons that, or the risk factors that can put us at risk for an earwax blockage. Having so much earwax that's not coming out that can cause the symptoms I mentioned: ear fullness, ear pain, itchiness, decreased hearing, dizziness, all ringing in the ears, so many things. Now, you guys are probably saying, but how do I remove the earwax? I have videos on that. And it's not Q-tips. No, 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 no. No Q-tips. But I do have a video on that and other videos on earwax and stuff like that. Just check out the description of this video. Those videos will be in there so you can take a look. Also, if you don't see them, just DM me. I'll send you the video on how to clean out earwax safely. Also, I have videos on how we do it in the office in case you're interested in having that done too, which, by the way, is very likely the safest, okay? Guys, I'm Dr. Jen Caudle. I hope this was helpful. Let me know in the comments. Share this video with anyone you think could benefit from it. On Facebook, please like and follow my page. I do daily videos. Also, for those of you who send stars, thank you so much in advance. Consider joining my exclusive subscription groups, Dr. Jen Superstars, for content that you won't get anywhere else. YouTube, subscribe to my channel, please, and click the little bell for updates, and also subscribe to my subscription groups there as well. You guys have access to private lives. In addition, I'm on TikTok and Instagram, so join me there, and go to my website, Dr. Jen Caudle, to join my free health newsletter. Guys, I hope this was helpful. Hopefully, I got through all my points. Earwax blockage, cerumen impaction, no fun. Those are the things that can put us at risk for it. I hope this was helpful. All right, guys, see you soon. Bye.